Today we have this beautiful patient who's flown in from Albuquerque and has lost 100 pounds. Congratulations.
Yeah.
That's exciting. And she's had some plastic surgery back at home. Essentially, she has had a breast lift, arm lift, J-thoracoplasty, tummy tuck, and butt lift. And is here for thigh work, probably buttock redo. She has had this beautiful arm lift and it looks really amazing. You can see the scar here. This is a posteriorly placed scar. Posterior means back, so the incision is on the back. This is a good procedure. The only problem with this procedure is the fact that when you have your arm down, you can actually see the scar from the back. In our practice, we place the incision at the junction between the front of the arm and the back of the arm. So our incision would be about an inch further in the front, and then we would come down here. But overall, very nice work and very great results, I would say, for her arms. She has had a breast lift. I think the breast lift, again, has worked. This is probably standard breast lift, so there is no breast reshaping. There is no internal dermal bra in a weight loss patient. Unfortunately, the standard breast lift doesn't last long and you get a lot of sagging of the breast, and she's already gotten that. Another thing that I want to show you is her breast unit. This breast unit here is very low on her chest. This is her 11th or 12th rib, and this mammary crease that they place, you see already the breast tissue is migrating below the skin, and this mammary crease should have been reconstructed, should have been tightened, and if you tighten it here, then the breast unit is still low. So what we normally would do is to do this, reposition the inframammary fold over the 6th rib where it's meant to be, and then perform a breast lift from that point. And when you do that, then your breast lift will end up being higher, essentially repositioning the breast and then lifting it from that point, and you'll end up here, especially if you do an internal dermal bra breast lift. But this is very important because look what it does to her tummy. It actually makes the tummy appear much longer, and that's what you want. You want the breast to cover about a third of her front or the chest unit, and then the abdomen to appear to be about 2/3 of the front. Coming to what really bothers her at this point, her thighs, she's got vertical laxity of the front of the thighs, outer thighs, back of the thighs, and inner, and she also has horizontal or circumferential laxity. So she's gonna need a comprehensive circumferential thigh lift and a thigh reduction. I would have obviously done that much earlier with her tummy tuck because she's got all these incisions. So through those incisions, we could have lifted the front of the thighs, lifted the outer thighs for her. And then on the back side, I see this quite often when plastic surgeons are trying to hide their incisions lower and lower. Instead of placing the buttock incision at the junction between the lower back and the upper butt, they actually go over the butt. So I wouldn't do this, and you can see this and see if this is something that you would like. But you see her lower back skin has been pulled down way, so her buttock appears to be this long in the middle, and then the scars goes that way. What's the problem with this incision? You were telling me.
It's too low in the middle, and it creates a panty line through all of the clothes that I wear. There's an indentation in the middle of my...
Yeah. A, you can see the scar more often than not. B, you wear a thong and the scar is visible. You cannot wear a thong. Most of our patients can actually wear a thong. And C, the other thing that they didn't do is obviously buttock reshaping, buttock enhancement with lower back fat, buttock fat transfer. So none of that was done, and the buttocks obviously look square and small. Fortunately, we can correct this. Not always I can correct. There are some times that we can't actually revise things. One of those is when people put scars this way, which is hideous. I'm sorry, but they do that. So you really need to go to somebody who does these surgeries correctly. Her buttock crack starts here. So this needs to come up, and then this needs to come up, and all of this excess tissue can be utilized to augment her buttocks width. The way I would do this is I would do a buttock reshaping, buttock augmentation, redo outer thigh lift, and I was just showing here we can remove about 4 to 5 inches of remaining skin. You see that? This can be cut, this tissue can be utilized to augment her buttocks. Then I would lift the front of the thighs, then I would do a thigh reduction to make her thighs smaller. By doing all of that, I think we can significantly improve her results as well as correcting her thighs. One other thing that you'll notice is that as I'm lifting this up, you see she doesn't really have an infragluteal crease. The crease between the lower butt and the upper thigh is very loose in her. We may have to create that crease for her so that when you look at the back view of her, you can look at these creases that normally exist in people and define the border of the butt and define the border of the thigh and so forth. Otherwise, it looks as if her buttocks and her thighs are merging into one unit.